What's up, you guys? My name is Miguel, fellow Xray Tech here, giving you your daily dose of radiation. In today's video, we are covering... I just got off work, and I can say that I was blessed to work with one of the best ER doctors we have here at my hospital. And every time I work with this doctor, he gives me like hope that you can see the big difference between even working days and nights and what a doctor can do and just change like the whole way your night's gonna go or day. Like you can, like tonight it was really busy. We had a lot of people, a lot of traumas, a lot of stuff going on, and it's always, you can see, like in my brain I was like, well, if we had any other doctor to kind of order stuff, do what he got to do to help these people, it would go completely different. We would be slammed, we would be like, it would be chaos. And because we have the right doctors who know what they're doing, and just like regardless of how bad, how much like the work, they order what is necessary. And even if they order a lot, you know something's gonna be wrong because they truly need it, and they don't order unnecessary stuff. And it's just day and night how different the workflow and everything, like, and even just being able to communicate with doctors, because certain doctors, like, they'll order stuff and then you're like, hey, this happened, or hey, the patient da da da, and they're like, this is what I ordered, this is what I want. No wiggle room, no nothing. And sometimes, depending on what's going on, you're like, you're right. We're just, some stuff is like, we just got to get done so you can see what's going on. And other times the doctor's like, you know what, we can do this. Or what, I'll work with you and we can do this. Or you know what, because of the patient, we can do a CAT scan instead of moving them and doing this, maybe, you know. Like, the longer you work in the field and you get to work more nights or days or whatever, you can kind of, you can kind of like tell and just see the difference. Like, I understand most people don't like going to work. Most people have stuff going on, or like doctors, a lot of them, they have so much, like, especially overnight, it's just like one ER doctor and like one nurse practitioner, and sometimes it's just one, and they'll be stressed out. And then you have like the right doctor that's just like calm under pressure and just take care of business. Like, it's the whole ER completely different. There's been times where we worked and it's like a few doctors that we know, they're notorious for ordering, for like just lighting up. At first we thought it was only our department, and then one time we just started talking amongst the other medical people outside of the doctor, and it's just everyone. You can just like look at the face of the nurses, respiratory, patient, you can just see when that certain doctor comes in, just the whole workflow, the dynamic. Today it was chaos, a lot of people, a lot of work, a lot of stuff, but everyone was happy. There was no like just completely different vibe. Like, it was like certain doctors make you want to actually come to work and help. Like, you know, you're like, you feel like you're needed, the way they treat you, the way it's just a beautiful thing. I wish everyone who works this beautiful field of X-ray especially gets the opportunity to work with those doctors. And like at my hospital, we probably have a roster of, I want to say like probably 10 ER doctors, and we have only 2 of them that are the most beloved, and everyone you'd pick up overtime, you do whatever with those 2 doctors. And I hope everyone in this field gets to experience that and gets to work with people like that, because they make you feel like you're actually doing something, and you're not just, overexposing people, or you're never questioning like, why am I doing this? Or even if they do decide to order a lot, like it doesn't even bother you. Like, what, I'll take care of this, it's no problem. You wouldn't even get mad. Like there's been like tonight he ordered like a few extra exams that he usually doesn't, and like other times we would be like being mad, be like questioning stuff. Like certain doctors like him, like it doesn't even bother you. Like, I'll take care of business, and like it makes you feel like I hope everyone experiences it. It is quite a nice thing. It like you actually want to work, like come into work, and it's something that I hope everyone experiences in this field, because majority of the times most people don't like going to work, and it's just at work. And especially with our field, it's very easy to over-order stuff, especially if the doctors don't know what they're looking for, and it's kind of a guessing game in a way of, let's see what's broken. Because like depending on the doctor, some of them will order a bunch of stuff prior to even assessing their patients, and like especially if you come in and do it, sometimes like even the patients will let you know. They're like, hey, why are you doing all this? I haven't even seen the doctor. And then, or they're like, the doctor, like I told them it was this, but depending on like what kind of story they tell the nurse and they put in the information into their chart, the doctor will just start ordering stuff, and they're like, well, yeah, all that is true, but I only came for this or only came for that. And you can just kind of tell what kind of like doctors or stuff in your workflow will change dramatically. Once again, I hope everyone is blessed to work with certain doctors that treat you well, and like a big difference, huge difference in like just it changes the dynamics, because majority of the times I've worked days and nights. I dabble in both teams, and in day shift, I don't think they really even have those kind of doctors that we have at night. That like. It's been your boy Miguel. I hope everyone out there is doing good, and